Dr. Mary Ruwart has worked in the medical research industry for 20 years. She's the author of Healing Our World in an Age of Regression and short answers to tough questions. And she'll be speaking on the only solution to the healthcare crisis. So.
Well, thank you for that very warm welcome. I really appreciate it. And I'm here to talk about a subject that is hot in the news and that libertarians have the only solution to. I guess there's many topics like that, but my favorite one is healthcare. That's because I was in the industry so long, and actually still am to a large extent. So let's get started and find out why libertarians have the only solution. You know, if you think about it, there are a lot of things going on right now that if you're not in the healthcare industry or you haven't had a loved one die of a terminal disease, you might not be aware of. I have had that misfortune, and I can tell you that even private healthcare today is rationed. What happens is that if you're not at your loved one's bedside 24/7, you don't always get the treatment you want because there is such a demand on the medical personnel that they just can't service everybody the way they'd like. Okay, I'm not loud enough. Okay. And so now what's happening, of course, things that many people are aware of is that there is rationing in the government-paid programs too. Many doctors are refusing to accept Medicare patients anymore because Medicare does not reimburse the physicians. And the VA is turning away veterans if they have income that the VA considers sufficient to pay their own medical bills. So a lot of rationing is already starting to happen. And that is because healthcare costs are so high, nobody can pay for them. The government can't pay for them, private individuals can't pay. So what we really need to do is bring down the healthcare costs without sacrificing quality. Now, there are a lot of people who talk about the runaway litigation, and that really accounts for maybe 5 to 10% of the healthcare costs, the excess litigation costs. And then a lot of people talk about the fact that so much of our medical care is paid for by third parties, like insurance or government. And yes, that is a factor that maybe accounts for about 20% of the waste. But the big factor that very few people talk about is regulation. And the reason they don't talk about it is unless you're in the industry, you probably don't see it. But regulation is prominent at every aspect of healthcare. And it's kind of hard to get your hands on in some ways because a lot of it's done at the state level. Let me give you an example. First of all, I want to impress upon you that these regulations are not stagnant. They're set up in a way that they increase every year almost automatically. There's a lot of leeway given to licensing boards, for example, and every state has one for doctors, nurses, and other medical personnel, and they pretty much have carte blanche to change things as they see fit. Similar with hospital regulations and insurance mandates, which keep increasing. So these are all regulated pretty much at the state and local level. So they're kind of hard to get a handle on because they're so numerous. It's a little different with pharmaceutical regulation, which is what I'm going to mostly talk about today as an example. Everything I talk about in the pharmaceutical regulation happens on the local level. But the reason I'm going to talk about pharmaceuticals is it happens at the national level. And so it's more uniform. When it changes in very discrete increments so we can actually measure the effect. And I want to measure the effect for that because it really constitutes somewhere between 50 and 90% of our healthcare costs. It's a big one. If we want to cut back on healthcare costs and make it affordable, we have to cut regulation. There is no other way. If we keep on like we are, already no one can afford it, and pretty soon no one will get it. So that would be a very bad situation. So to start, I'm going to talk about the 1962 Kefauver-Harris amendments. Now, don't be intimidated by the graphs I show. They're going to be pretty simple, and I'll walk you through. These regulations, which I have indicated up here, were passed in the wake of the thalidomide tragedy. It was the biggest drug tragedy of the time. It happened in Europe, not much in the US because the drug wasn't available here. And what it was a replacement for barbiturate sleeping pills. It was much safer than barbiturates, but it wasn't safe for pregnant women to take because it affected the baby's development. They were born without arms and legs. I know many of you, I can see, are old enough to remember this, as I am. It was pretty terrifying at the time, and it scared people even in the U.S. And there were regulations, these Kefauver-Harris regulations had been languishing in Congress for 3 years before this, and they were hastily passed to reassure the American public that this wouldn't happen to them. Well, these regulations would not have prevented the thalidomide tragedy, but they created an American thalidomide tragedy, which I'm going to talk about later, that was almost invisible to the American people. They really, really backfired. And one of the ways in which they backfired is they increased the time it took for a pharmaceutical manufacturer to take a brand new drug from the lab bench to the marketplace. Here you can see in blue that between 1948 and 1961, it took about 4.5 years for a new drug to make it from the lab bench to the marketplace. After the amendments were passed, you can see the impact in brown. Every year, the regulations were increasing the time of development until by 2000, it was about 14 to 15 years. Now, think about it. If you have a terminal illness, can you wait 14 or 15 years for a new drug? Of course not. And when the AIDS epidemic hit, I was working in the early years of that, and the AIDS patients decided they didn't have time to wait. So they broke the law. They contracted with black market chemists to make the drugs that we were working on in the pharmaceutical industry. And by the time the FDA gave us permission to test these drugs in people, every AIDS patient in the country that wanted them had already had them because they got them through their black market chemists. And they had a pretty good safety record. They actually talked to each other, distributed the drugs in a pretty safe way. And if you want to learn more, it's quite an interesting story. I highly recommend Whitney's book, Acceptable Risks. Now, the FDA did not go after the AIDS patients, and the pharmaceutical companies did not go after them either, even though they were violating patent laws by making these drugs. And of course, I think that was a good thing, obviously. These are sick people. But had they gone after them, it would have made it clear to everyone that the FDA is really delaying getting life-saving drugs to market. And this might have caused some reform. So I guess it was kind of a two-edged sword. Well, the cancer patients didn't want to go that route. They wanted to be legal. So what they did is they lost. And how they went about this is they sued the FDA because they said that they had the constitutional right to save their own lives by buying drugs from the pharmaceutical companies that had been tested in humans but hadn't yet been shown to be effective. First, safety testing happens, so that had been done, but effectiveness testing follows after that. So, what they did is they sued, and they won in one court, lost in the other, and they tried to take it to the Supreme Court. The Supreme Court refused to hear the case, and so the lower court ruling stood. There is no such constitutional right. We do not have the constitutional right to try to save our lives with unapproved drugs. Yeah, that was kind of unpopular with the cancer patients, as you might imagine. And I really believe this is just the first round. I think this is going to come back to haunt the courts. I believe this will continue, not in this particular case, but I think it's going to continue, especially as our population ages and more people want access to these drugs. But this is how it goes. Now, we can actually calculate, believe it or not, we can actually get a pretty good idea of how many people lost their lives or had their lives shortened by the FDA simply because of this delay in drug development. And the reason we can do that is we have a pretty good idea of how many lives are saved by the drugs that were put on the market up to about the year 2000. And when we do this calculation, we find that there are, let's see if I can get my pointer to work, 4.7 million lives lost due to the delays. Now, you can argue with this number a little bit, say maybe the estimate was off a little bit, but you can see the number is big. And how big is it? How does it compare to the number of lives that might have been saved by the regulations? Well, we know that information too, and the reason we know it is we know how many drug tragedies we had before 1962. So we can get a feel for how many people would have survived if they had been able to have these regulations in place. And if we're very conservative and say that we could have prevented every drug problem, every side effect that happened before 1962 with these new regulations, which of course we can't, but let's just assume that to give the FDA the benefit of the doubt, we would probably have saved about 7,000 lives during the same time these 4.7 million lost their lives. Now again, one can argue about that number, but it's got to be 1,000 times off to compare to this 4.7 million lives lost. So, as you can see, it appears that the FDA is killing more people than it saves. I have a cartoon in Healing Our World that kind of describes the situation. Here we have the guns of government keeping the new therapies from people who are terminal or wheelchair bound, and telling them that their disease may kill them before these life-saving drugs are available, but at least they'll die safe. And of course, there is no safety for someone who's terminally ill. That's why this is so, I would say hilarious, but it's so tragic that actually that word doesn't apply. It is very, very sad when we have very sick people that are willing to take the chance that something might work for them and thereby give us great information about the new drugs. They're willing to take that chance because they don't have any other chance. So this is very sad. Now, as you might imagine, this lengthening of 10 years on development time, the difference between 4.5 years to 14.5 years, costs a lot of money. And once again, don't worry about the graph here. It's actually pretty simple. Basically, on the, my laser pointer is failing me here. Basically, on what we call the y-axis, hang on. It's a new computer. I haven't trained it yet. Okay. So basically, here we go. On the y-axis, we have the research and development costs for each what we call new chemical entity or new drug in $2,003. And down here, we have the median year of approval. As you can see, before the amendments were passed, between 1950 and 1960, regulations were already increasing the cost of drug development, but it was pretty low. If we extrapolate out into this area, we'd see it's about here. But if we look at what happened after the amendments, you see how steeply the cost increase became, and it's still rising. And if you look at the difference between over here and over here, you can see where the increase in the drug costs at your pharmacy come from. So, oops. And basically, this is just a graph showing you that there's, not surprising for any libertarian, there's a direct correlation between how much we have to spend at the drugstore and how much the manufacturers have to pay in research and development for their new drugs. It's, a very strict correlation. Well, based on these graphs, you can actually calculate, oops, Yes, oops, wrong one. Yes, if the pre-amendment trends had continued, pharmaceutical prices would be about 15% of what they are today. That's a huge number. Now remember, everything I'm saying about the pharmaceutical industry pretty much applies to the medical industry too. It's just harder to put those all together because there's multiple regulations there, as we talked about before. And of course, there's I haven't even really touched on, this is the scary part, I haven't told you the bad news yet. I've only started. The delay is only part of it. A bigger problem is the loss of innovation. And I'm underestimating the loss of innovation. Here I'm saying that the loss of innovation is about half because the manufacturers have to shift from doing research to doing development. In other words, instead of discovering new drugs, they have to satisfy these regulations. So that's what they do. They spend their money that way. Now, this figure of 50% actually is very low because what it represents is the number of drugs that are stopped just before they go to ask FDA for approval because the manufacturer realizes late in the game it's already cost them so much, there's no way they're going to recover costs even if they market this thing. So they drop it. Totally economic reasons. And you know, a lot more drop out even before that because before any drug goes into development, the MBAs get together in the company and they say, okay, let's figure out how much it's going to cost us to develop this. Nope, we're never going to be able to recover these costs. We won't do it. I'll give you a real life example to show you how bad this is. I had an FDA examiner call me up one day and they said, Dr. Ruwart, we're all excited. We understand you just filed a patent for the treatment of liver disease with prostaglandins. I said, yes, I did. They said, that's fantastic. There is no way to treat liver disease. We want to help you get this drug to market. Well, of course, I'm going, finally. But you know, even with the FDA doing everything they could, it wasn't going to work. Do you know why? When you have a new breakthrough drug, you don't know how to do the study to show the effectiveness. For example, in liver disease, what do we measure? A parameter in the blood? Do we take a biopsy of the liver to look at it? How long do we have to treat the people? It took a long time for their liver to become fibrotic and cirrhotic. How long is it going to take them to cure them? And what dose of the drug do we have to use? And if we do this study, which is going to take us years, and we haven't guessed right on all those answers, what we call the statistical significance won't be good enough for the FDA. And if it's not, we have to start all over again. And by then, our patent's gone. And if we don't have a patent, we can't recover our costs. So my company decided not to develop prostaglandins for liver disease, even though we had the support of the FDA. Pushing. Yeah. That's how bad it is. Now, if you think about it, and this is something that a researcher in this area, Warden Wardell, said, he said, if even one new drug of the stature of penicillin or digitalis has been unjustifiably banished into a company's back shelf because of excessively stringent regulation, that event will have harmed more people than all the toxicity that has ever occurred in the history of modern drug development. And he's right. He's right, because a life-saving drug saves so many lives compared to the number of side effects that one normally would see. So it's really a big tragedy not to have innovation, and you can kind of calculate both in lives lost and in money, depending on how effective you think these lost innovations would be compared to current ones. For example, if you think they'd be just as effective as the current drugs, that's 16 million people. 16 million people that had their lives shortened because these innovations weren't on the market. If you think they're only a quarter of as effective, that's another 4.1 million. So you see this far exceeds probably the impact of drug delay. And remember, these are conservative estimates. It's also true that it costs a lot in money. You know, when you think in 2003, the healthcare expenditures were 16 billion, 1,600 billion, and you look at the billions here that it's costing us for loss of innovation, you can pretty quickly figure out that about 25 to 55% of our healthcare costs are due to loss of innovation in the pharmaceutical industry. And remember, other types of healthcare regulation have this impact too. Now you can start to see why healthcare is so expensive today and why deregulation is truly the only solution. So let me get a little review here before we go on, and I give you the worst news, because I've just gotten started. These amendments in the pharmaceutical industry account for about 85% of current pharmaceutical costs. They kill at least 100 times more people than they save. The real number is probably closer to 1,000. Again, I'm being conservative. And they've probably doubled the current health care costs. And I just want to give you kind of an example of why that happens. You know, when the first anti-ulcer drug, Tagamet, came on the market, it was very expensive. It cost about $2,000 for two one-year terms of it. That was a lot of money back then, because this was back in the, I think it was back in the early 80s. But if you didn't have that, what was your option? Surgery. You were out of work. You had to have a $25,000 surgery. And, of course, you had all of the side effects of a surgery, which sometimes they can't quite put you back together right. So you can see why it is so important to have a drug instead of surgery or other treatment if you can get it. So that's why the healthcare cost burden is so high when you don't have innovation in the pharmaceutical industry. But here's the biggie that I have really no good way to estimate, but I think you'll see pretty quickly that is the most important part of the Kefauver-Harris amendments and what they did to what was going to be our golden age of healthcare. Treatment, not prevention, became the norm. Basically, the Kefauver-Harris amendments outlawed prevention. And let's talk about that a little bit. First of all, I guess I want to explain to you how important prevention is. Before the advent of genetic manipulation, in the olden days of pharmaceutical research, the way we made our animals sick was to take away their vitamins. There was nothing else we could do. Our rats were so healthy, they didn't get sick. Yes, they did die of old age eventually, but you know, if you were looking for diabetic rats or obese rats or things like that, it was a little difficult because the rats were pretty smart. You know, rats won't drink alcohol unless you take all their food and water away and only give them a chocolate shake with alcohol in it. Chocolate is the only thing that will induce them to drink alcohol. You can put alcohol in their water and they will thirst to death rather than drink it. So, you know, they're very smart. Anyhow, bottom line, though, is the way we made our animals sick was to take away a vitamin or two, and then they would develop the diseases that we were trying to treat. Now, this is kind of a little hint, you know, that maybe these diseases were caused by not having enough nutrition. But the reason that never caught on is that at the time of the Kefauver-Harris amendments, most of the vitamin and nutrition research was actually being done at the drug companies. They were actually synthesizing the vitamins, so there was enough for people to take on a regular basis, and they were the first ones to put out the one-a-day multiple vitamins and things of that nature. Now, they were low potency compared to what we get today, but they were pioneering this. And when the Kefauver-Harris amendments came along and demanded that you showed effectiveness, they quickly realized that they were going to anger the FDA if they tried to make claims for their one-a-day multiple vitamins. You know, oh, these will help keep you healthy. Well, that's a drug claim according to the FDA. And if you don't go through all these regulatory hoops, you can't say that. So they had to make a choice, pharmaceuticals or nutritionals. And they, of course, made the only choice they really could have, which was the pharmaceuticals. So when they went into the doctor's offices to tell the doctors about new drugs, they couldn't tell them, well, you know, your patients can take vitamin E instead of the drug we're offering because it works just as well. If they did, they would have been violating the law. But in fact, that's exactly what happened. I remember I was on a plane one time, and I had a gentleman sitting next to me, and he said, hey, I hear your company's developing these compounds called Lazaroids, named after Lazarus, the biblical Lazarus rising from the dead, because these compounds were doing such wonderful things. And he said, can you get me some of these? I said, well, you know, they're not on the market yet. I'll check with the project manager and see what we can do. The project manager said, no, we can't give out this drug even on a compassionate use protocol right now, but just tell them to take lots of vitamin E. It does the same thing. So why are we developing this expensive drug when we could give people vitamin E because we're not allowed to tell them about vitamin E. And if we brought them through this big process of drug development, what would have happened was every other company could do it because it wasn't protected by patents, so we couldn't recover our costs, so it doesn't make economic sense. So that's one of the problems. And that's really sad because I think a lot of our diseases today probably are nutritionally based. And with proper nutrition, we would probably save lots of money. I can't calculate how much quite yet, but as you can see, it's probably big. And you know, the FDA, the reason the FDA can get away with this is they say that the First Amendment does not protect commercial speech. Really. And this has been challenged in the courts. And the FDA has been told that it has to allow claims for some nutritionals, but they haven't obeyed the court. They've been hauled back into court, and this has gone on for some time. Well, one enterprising company said, well, you know what, fish oil is so important, I think we're going to give it a whirl. I think we're going to go ahead and jump through some of these regulatory hoops because cardiovascular disease is the #1 killer. I think we can sell enough of this stuff. So they did. You can now get prescription fish oil. The copay for prescription fish oil costs as much as if you went to the store and bought the same thing from your nutritional supplier. That's just the copay. So that means your insurance company is paying another 9 times that. Another reason why healthcare costs are so high. But what this manufacturer now can do is it is legal for them to go to the doctors and say, our fish oil is the only one approved by the FDA for cardiovascular disease. And the doctors will buy into this and prescribe this because they don't have much nutritional training. Our doctors do not get much nutritional training, and that is because of the licensing laws surrounding physicians. So you can kind of see how this stuff starts to overlap. Okay, so what can we do about this, and where are we going with this? Well, one of the things that's happening is there is the Healthcare Freedom Act, the Health Freedom Act, HR 2117 that was proposed by Ron Paul, and that would allow nutritional claims for supplements and things of that nature as long as there was some scientific evidence, some. Because, of course, the FDA doesn't care for the evidence that's there, and they rule it out. So that's a good thing, but it hasn't passed yet. So I just wanted to make you aware of that in case you're looking for a way to do something about this. So I just want to conclude and say that excess regulation, and I'm calling regulation, excess is, well, just about everything, but I'm going to define it here as regulation that harms instead of helps. And with that definition, that probably wipes out almost every regulation on the books, and it's largely responsible for the soaring healthcare costs. And cutting out this regulation is the only way, truly the only way, that we are going to be able to reduce health care costs without compromising quality. Anything else we do is going to compromise quality by rationing or some other method that just isn't going to be available. And sadly, most people don't know. Now, most drug development happens in the United States. So when drug development here is curtailed, when innovation slows, this ripples out to the rest of the world. It doesn't just kill Americans, it kills people in other countries too. And this is very bad. So one of the things I want to leave with you is that what happens here doesn't just stay here, especially in the pharmaceutical industry. It does ripple out. And remember that I'm only talking about one aspect of the healthcare industry right now, because the others, all the occupational licensing and the insurance licensing, the insurance regulations that happen, that also has an impact, and that accounts for a lot of the problems too. Libertarians have the only solution to the healthcare crisis, deregulation. That is the message I want you to take back with you, because you are the only ones that are going to be out there talking about it. And so far, we haven't done a very good job. So what I'm hoping is that this presentation helps you understand what's going on, helps you convey it to the people that you are aware of that are concerned about this, and hopefully because we're going to have a big crisis in healthcare with all the baby boomers retiring, we will be able to come forward and put forth a solution that actually works, not just for the American people, but the world. Thank you. I guess I'm going to take questions. Do you want to pick people and bring them the mic? You go ahead and do that. That'll be easy. And I'm going to try to get a sip of water.
Can you speak to how patents affect the healthcare industry, not so much the regulation, government end of it?
Yes, well, there have been some studies. The question was about patents. How does it affect the healthcare industry? There's been some studies done on patents and how they affect different industries. And interestingly enough, the ones that are affected the most positively by patent protection are the ones that are the most heavily regulated, which shouldn't surprise anybody, because back when I started, we didn't care if we had patents or not, because that wasn't important. It was only as the regulations increased that it made it necessary to have a patent. So patents are sort of in my opinion, it's kind of a status band-aid to put on a status problem. I mean, we wouldn't need patents if we didn't have all this regulation. So I think they would fade. The other industry that's heavily influenced by patent protection is the chemical industry, another heavily regulated industry. When these amendments passed, there were a lot of problems. I'm not able to show you everything. I'm writing a book on this, actually. That's how big of a topic it is. But what happened after these amendments passed is the new drugs that were, like up in the stratosphere in the beginning, after 62, all of a sudden there was almost no new drugs. And then in 1980, they changed the patent law so that universities could patent their inventions. Before 1980, if it was done with public money, they couldn't patent it. And therefore, it couldn't be developed anymore because the regulations made it too onerous. Once they did that, though, then they could have new drugs because they could partner with the university. So that's the impact.
So I have the question. I think the patent window right now is like 17 years or something. How long do you think it's going to take before the testing and R&D window overtakes the patent window and you practically can't patent a particular medication?
Yeah, actually that I think is happening now. The question is, when is the patent life going to be short enough that you can't recover your costs? And actually the effective patent life is only about 10 or 11 years. And that's because when a company discovers a new drug, it files the patent right away, then starts the development process, and about halfway through the development process they're granted the patent. So the patent clock is ticking already as they continue development. So by the time they get it to market, they don't have much time left. And I think that's coming up. Right now the companies are struggling. They don't have new innovations because it's too expensive to do something new. I was telling you about the liver disease problem. When you have something new, you have additional challenges. In fact, it's hard to develop a compound that isn't going to be used chronically now because you can't recover costs. We're already in that place where the companies are just tweaking the compounds a little bit and doing me toos because they know they can get approval. And it's just going to break down. That whole system is going to break down. And the threat, I'll say, the threat that faces the FDA is that a lot of people are trying to go around the problems with making claims for nutritionals and supplements. It's getting very hard to tell what's a supplement and what's what. So and there's a big libertarian movement. I have to tell you, this is, if you aren't engaged in the nutritional and supplement areas, you need to be, because the activists are there. Congress got more mail over the FDA trying to take over nutritionals than any other issue. And it happened twice. These are the activists, and they're ours. The leaders of this movement are ours. They're overt libertarians. So we need to be coordinating with these people, getting them in here. So once that happens, there is not going to be an effective FDA, because think about it. If you can make a claim for a nutritional without having to jump through all these regulatory hoops, who's going to want to be giving people chemicals with all these side effects? You know, it's not going to happen. So I think the system's going to break down, especially with the baby boomers. Let me share one other thing that the FDA is doing, because I'm very hot on this. Adult stem cell research. They now know how to take the stem cells out of your body, culture them for a week so that they have a lot of the better ones, and then they inject them to your knee or hip so you don't have to get a hip or knee replacement. This is hot stuff. Except, you know what? The FDA says if you culture them for a week that they're drugs. Yeah. So the docs, you know, that are doing this work, they're just, you know, in private practice, maybe with a group. They can't afford $1 billion to develop a new drug. I didn't actually overtly say that. I pointed to it on the chart. The out-of-pocket costs, the actual money that a pharmaceutical company lays down over those 15 years is about $500 million today, okay? That means if you count like the interest in borrowing that money or the lost opportunity cost, it's $1 billion for a new drug. That is a lot. No doctor's office is going to afford that to do, get a patent or something on their stem cell process, even if they could. It's actually kind of hard to do that. So they're going offshore. So the only people who get these treatments are those who can afford to go offshore. This is crazy, because think about the cost savings if somebody doesn't need a knee or hip replacement. It's just crazy. So, you know, this is also going to be